Hi, I'm Dr. Winnie from the Monty Mix Vets, and I'm here today with my dog Kobe. Now, Kobe's a 12-year-old Japanese Spitz, and those who are regulars would have seen him on our wall in the waiting room, his picture. So just a bit of backstory about Kobe. I rescued him when he was about 4, and when he came to us, he had a whole lot of issues. He was so overweight. His fur was all matted, he had dental disease, and he had a real fear of men. You know, he didn't trust men, he kept running away, and he just kept barking at everyone who was dressed in black, or if you're a man, he would just keep barking at you. So, I mean, over the years we've socialised him and trained him out of that, and he's a lot more trusting with men now. So, but what was also apparent was that he had a bit of a limp in that left foreleg. And when we x-rayed the leg, we realised he had an old fracture, or an old healed fracture, and it's just developed arthritis in that leg, which has become really bad. And over the years, he's just placed pressure on the wrong parts of his leg, and his arthritis has progressed, and it's quite bad in his wrist. In fact, he needs a surgery that where we have to fuse that wrist together so the pain goes away. And at the moment, I am saving up for that surgery for this old boy. So basically, I just want to tell you about how I look after him in his old age. He's 12 now, so obviously there are things that, you know, it's changed over the years. And with an older dog, you know, we consider dogs over age of 7 as seniors or geriatrics. And the thing is, I mean, with dogs, they age a lot faster than we do. So one of our years is equal to 7 of their years. So you can imagine how quickly things change and how they develop disease a lot faster than us. So, you know, the things I do for Kobe, you know, in his old age, is that I make sure that I get him tested, get his bloods tested twice a year, so that we can pick things up early on, you know, pick up things like kidney disease or liver disease, if he's anemic, things like that. These things can change really quickly, so of course, if there's any sort of metabolic issues like that or medical issues, I'd like to know earlier so we can do something about it earlier. I check his teeth regularly because that seems to be an issue with senior animals as well. They get a lot of dental disease. Kobe's really good in that he'll let me do anything. He'll let me check his teeth, he'll let me open his mouth, he'll let me brush his teeth. So he's amazing that way. But I understand that some of you can't, you know, your dogs don't let you look in their mouths or even brush their teeth. So, you know, at least once or twice a year, we really need to get them checked out, and some dogs will just need dentals once a year. You know, Kobe gets his fair share of dentals. We come in normally once a year to get his teeth clean, but I try and do our dental hygiene in the meantime as well. He loves his dental chews, he loves his Orabet, so I give them to him every day, as well as twice a week. I give him something bigger to chew on as well, to scrape off that tartar. So also with his weight, because he's prone to putting on weight and we don't want him putting extra pressure on his joints. So he's on a metabolic diet to help maintain his lean, sexy body, but that food also contains mobility support as well for his joints, so it's perfect for him. In terms of, you know, arthritis and looking after his joints as well, I make sure that he's getting a lot of joint support. So every day he gets a little chew for his joints, and he also gets a monthly Cynovan injection, which is an anti-inflammatory, and it contains glucosamine as well to rebuild some of that cartilage. When I do remember, I will do acupuncture on him as well, which really helps with his joints. And being a bit older now, I've noticed in the last year or so he's lost his hearing. One day I came home and he was asleep, and he didn't even hear the door open, he didn't even hear the garage door open, and I actually had to step over him to get in. I thought he was dead, but actually he's just so deaf that he doesn't hear anymore. So we try not to startle him anymore. Like when he's asleep, we try not to sneak up behind him. I'll have to, you know, clap really loudly or stomp my feet so that he'll feel the vibrations and, you know, come to me. But he's also a bit blind as well, in that he's got cataracts in both his eyes. So I try not to move any furniture around so he can, you know, find his way around the house easily. Other than that, I think he's doing pretty well for 12. I mean, you wouldn't know by looking at him that he's an old fogey, right, Cobes? Still handsome. And also, I guess, to prevent all this slipping and sliding on our tiles, I try and clip the fur between his toes because it gets a bit long, and then he can't get traction on the tiles. So I find that tends to help, as well as keeping his nails nice and short. So yeah, that's basically how I look after Kobe. I hope that's helped you as well. If you've got a senior dog and you've got some questions, please don't hesitate to call the clinic or leave a comment below. Well, thanks for watching, and we hope to see you next time.